Hello, my name is Victor Enriquez, gastroenterologist. I'm going to present our work of portal venous thrombosis or PVT in transplanted cirrhotic patients at the Hospital Clínico Universidad de Chile. PVT is a frequent complication in cirrhotic patients on the waiting list for liver transplantation, and this is associated with increased post-transplant mortality. There is limited information at national level regarding PVT in liver transplant. The objectives were characterize the presence of PVT pre-liver transplant and during transplant surgery in patients with liver transplant in our center. This is a retrospective observational study between 2014 and 2018. Clinical records, laboratory, and images were reviewed and survival was recorded. 82 patients were included. The mean age was 58 years. The principal etiology of cirrhosis was non-alcoholic fatty liver disease in 40%, followed by liver disease, autoimmunity, and viral hepatitis. Most of them were child plug C, 62%, and the mean MELD sodium was 22. PVT was diagnosed before or during liver transplant in 22 of the 82 patients, 26.8%. The characteristic of the patient with and without thrombosis, such as demographic features, severity of cirrhosis, etiology, presence of hepatocellular carcinoma, ascites, esophageal varices, and mean albumin pre-liver transplant were compared, and there was no significant difference in any of these characteristics, except in NASH etiology, which was 54% in patients with thrombosis versus 35% in those without thrombosis. The most frequent degree of luminal obstruction was partial occlusion that occurred in 20 of 22 patients. In them, the most frequent location was portal vein exclusively, in 10 of 22 patients. Complete occlusion was diagnosed in 2 of the 22 patients, all of them also only in the portal vein. The timing of diagnosis was during transplant surgery in 5 of the 22 patients, and pre-liver transplant in 17 of the 22 patients. In this group, the anticoagulation was starting during the waiting list in 13 of the 17 patients. None had complication associated to anticoagulation. Complete recanalization was achieved in 10 of 17 patients, and 8 of them were under anticoagulation. The 5-year survival was 70%, 63.6% in those with PVT, and 71.7% in those without PVT. This was non-significant. In conclusion, in this sample, PVT is a frequent complication in cirrhotic patients in the waiting list who receive liver transplant. Most receive anticoagulation without complications, and the 5-year survival in this area was similar despite the presence of PVT.